Cancer Alliance, and I do research at the Wright as well. So, and I'm going to show a few slides, like you said, that I presented earlier this year on the role of exercise and cancer. But I was listening and about the gentleman that was dealing with both the breast and the prostate cancer. And I just, there's a lot going on now with the link with breast and prostate cancer with the BRCA gene, which we commonly hear about. I don't know if that was discussed at all before I came in, but we've really transitioned when we're seeing men in the office to not just ask anyone you're dealing with prostate cancer, but also anyone in your family have breast cancer or ovarian cancer or pancreatic cancer, or certainly an individual with a personal history of breast cancer. Because we then move to talking about should we do DNA testing to see if you are a carrier of this mutation, which can put an individual at not only risk for higher risk of prostate cancer, but a higher risk of more aggressive prostate cancer. And then there's a downstream effect too, in that it does open the door for sensitivity to specific types of treatment if that is required. So certainly a new link that we're appreciating and to be aware of. So again, I'm going to tell you a little bit about exercise and prostate cancer. You know, you've had a lot of people come down here and talk here when you Dan Lim, Dr. Grimm, et cetera, about the different treatment options, and certainly treatment options for advanced prostate cancer, different new medications and new therapies that we are studying. But I think we often overlook some of the things that we can do individually as well. So exercise has been linked with just about every single cancer that there is. The less exercise you do, the more likely you are to develop several different cancers. And diet kind of plays into this too, and I know you guys usually have to talk on diet as well. But you can certainly see all these cancers. And not only are they associated, not only is a lack of exercise associated with a higher risk of cancer, but also once you have it, a higher risk of that cancer progressing as well. Now, there's clearly obvious benefits of exercise. You just flat out feel better, you improve your heart and lungs, and then obviously, that's a circle we call a competing risk of mortality, just from getting older and having heart and lung disease. Weight loss will obviously a huge benefit. But for those with prostate cancer or other cancers, there's tremendous benefit beyond just those things feeling better. Quality of life clearly improves, self-esteem, helps reduce anxiety, helps improve your vitality, decrease fatigue. Certainly a significant problem in prostate cancer is fatigue. And also exercise can help your brain as well and your emotional state of well-being. This is the details are not especially important, but this is a study where they looked at men who were on ADT, androgen deprivation for their prostate cancer. And we know that it's very common to have fatigue when you're on ADT. And they've looked, these studies have looked at different ways. Could it be strenuous aerobic exercise or resistance training, kind of weightlifting, etc., and how those can improve fatigue, and reduce fatigue and improve one's vitality. And what these different graphs show is that these were men that had been on ADT, and the more profound their starting point was. So the weaker, the more tired they were, the bigger their improvement in fatigue and vitality with exercise. If you weren't having much problem to begin with, you didn't see much benefit, because you wouldn't improve much already if you're not very tired to begin with. But I mean, we're seeing dramatic improvements for those that are having the most fatigue and the worst loss of vitality with exercise. Now, how in the heck did exercise help to improve cancer-specific outcomes? This is a complex slide showing multiple different pathways. It could be through inflammation. We know exercise reduces inflammation. Inflammation is a hallmark of cancer. We know that just the alteration of estrogen and testosterone with exercise as well, and there's insulin pathways, all these different things. The bottom line is I don't think it really matters for each individual how the actual mechanism is. The bottom line is there's multiple pathways that may be able to impact that cancer cell. And then our job at the Hutch, et cetera, is to try to figure out how these pathways may play. And just to give you guys some specific examples, this is looking at risk of aggressive prostate cancer. These are studies with tens of thousands of men followed over time. And they ask them along the way, okay, how much exercise do you do? And those that are getting a fair amount of exercise per week could have a 30% reduction in the risk of aggressive prostate cancer. Or another one showing upwards of 70% risk reduction in having advanced prostate cancer. So compared to those who weren't doing a moderate amount of exercise. And again, I'm not talking about going out and running, marathons every week. This is just some basic exercise, 30 minutes, 5 days a week of work. Now, what about those that already have cancer? These are a couple of different studies that have looked both at early prostate cancer localized and those that have more advanced prostate cancer and looking at the outcomes with those. Here's 1,500 men just walking more than 3 hours a week at a brisk pace, then almost 60% lower risk of disease progression compared to those that didn't. Again, that's tremendous. And these are men with localized prostate cancer, a dramatic reduction in the risk of disease recurrence and progression for those that are doing 3 hours, greater than 3 hours a week at a moderate pace. And another one looked at over 2,700 men doing vigorous activity, so maybe a little bit more activity, 60% lower risk of dying of their prostate cancer. I'm sure it's going to improve their overall survival, but it's also improving or lowering their risk of prostate cancer-specific death. So as was mentioned, we're weeks away from having this study open. We're participating with Movember. Some of you guys are all aware of Movember. The guys that grow mustaches to raise money, and it sounds really silly, but they've raised over $100 million for prostate cancer research, from you and I growing a mustache for a month, or the spouse in our life, friends in our life, supporting those of us that do it. So we've done it every year for like 4 or 5 years now at the UW, where the Mo dogs, the dogs for the Huskies. So we have a team that raises money. And so we have gotten, John Moore and I and others, some money from Movember in order to do different studies. And this is one we're lucky to be a part of. It's an international study to evaluate the impact of pretty significant aerobic and resistance training as well on cancer-specific survival and quality of life in those with advanced prostate cancer. So we're one of only 5 sites in the United States that are going to be participating in this through the UW, SCCA, and the HUD. So it's pretty exciting. And you may have had Evan Yu come down before and talk to one of the medical oncologists as well. So the target overall worldwide is 900 men with castrate-resistant prostate cancer, so the cancer that's progressed despite being on androgen deprivation therapy, with the primary goal, again, looking at survival. And they're going to have a number of other secondary endpoints, not surprisingly as well, to see how to improve people's quality of life, etc. So you have to, and they're since abiraterone and enzalutamide, 2 of these new pill medications that we are using commonly, they're going to think you can be on those medications and be in the study. They don't want patients that have previously had chemotherapy for their advanced prostate cancer because of the effects that chemotherapy can have potentially. And you need to have the PSA rising because of castrate-resistant disease. But really excited for us to be able to offer this. And one of the reasons we can is because we're part of the Fred Hutch, where we truly have an exercise prevention center right across the street from the SCCA. And we have a dedicated exercise physiologist who will be involved in this study. So men will be this is a randomized study. We're going to be randomized people so we can actually truly see a benefit. One of the goals of all of these kind of studies is to be able to show the government and insurance providers that these type of interventions improve people's lives, so we can then get a prescription, so that you can go and get this done and paid for. You have a heart attack, you go get cardiac rehab, standardized across the country. Well, there should be cancer rehab too, to improve our overall health, but we don't have that yet. So you're either randomized to just some general recommendations and some support groups that are done electronically, or you get the intensive exercise. So it is quite a bit coming up to the Fred Hutch and doing it quite frequently. And it's going to be over the course of a year is the intervention, and then we're going to follow patients for a couple of years. I'm just going to briefly mention that's in the advanced prostate cancer setting. We also have a lifestyle intervention, diet and exercise, in those with early prostate cancer. So we've certainly heard about men that have low-risk prostate cancer that select active surveillance. And we encourage active surveillance because the likelihood of having having the prostate cancer be a problem in the future is much less than the probability of having death from something else as we get older. So, but it's hard to do nothing for your cancer too. It's hard to get to wrap our brain around that. And again, since we know that obesity and lack of exercise can lead to progression, and it's been shown that obese men on active surveillance are more likely to have upgrading or progression of their disease over time. So the NIH and the NCI has funded this study called the Prostate Cancer Active Lifestyle Study, or PALS. And we have several people that you've seen before, Dan Lin, John Gore are on this as well, Ruth Etzioni, and Dr. Newhausen and Schenker, some other ones as well. And we're trying to see if we can understand how weight loss can influence cancer development. Again, getting back to that complex slide, we're trying to pinpoint which of those lines, which of those pathways can influence the cancer progression. It's also a randomized study, and not to belabor it very much, but it's not real. For the dietary portion, it's not a fad diet. It's essentially helping you to learn how to eat smarter, shop smarter, calorie reduction, and it's expected that over 6 months a person will lose about 7 to 10% of their body weight. So if you weigh 200 pounds, you can lose up to 15 to 20 pounds. And importantly, there's been shown that this intervention, you can keep the weight off 10 years later. So it really is a lifestyle adjustment. And built in with the diet is also, this is a picture of the exercise lab that we have. It's not really a lab, it's an exercise room. It's like a gym essentially at the Fred Hutch, where you would meet with an exercise physiologist multiple times over the course of 6 months, because it's so important to have the exercise component as well, not just reducing the calories, but also burning more of the calories too. We're actively enrolling, we're excited. What are the general recommendations? Really, it's not that hard. We're talking about 30 minutes a day, 5 days a week, trying to get to moderate or vigorous physical activity. Strength training is important too, because as we get older and we start losing muscle mass, our bones get weaker as well. We all struggle with that, men and women. And resistance training, doing some weightlifting can actually really help that as well. So I often get asked, well, what actually do you mean by this level of exercise? So the Department of Health and Human Services has put this up. So examples of moderate exercise, so 3 to 4.5 miles an hour. They ain't that fast. Biking at a little bit faster rate. I see a lot of people that say, well, I can't walk or ride a bike because of my hips or my knees. So yoga actually as well. Again, the weight training. Playing doubles even in tennis counts as moderate exercise. You happen to have a push lawnmower, that would count. So riding lawnmowers do not count for moderate exercise. And then certainly looking at the room, certainly a lot of you in the babysitting grandchildren. This actually is listed on the website as moderate exercise. Walking or pushing a child in a stroller, or handling uncooperative young children. I'm sure none of your grandkids are uncooperative, but you can come babysit my kids and they are pretty uncooperative. So lots of ways to get that moderate exercise. And this is a great slide. This is what we want to avoid. So incorporate exercise into your life every single day. If you golf, try to walk the course, or leave the cart, use it, and walk from the walk to the ball and walk back, so you get some exercise. And here's the picture of the guys going to the fitness gym and they're taking the escalator. Use the stairs whenever you can. It really does make a difference. So that's what I got about exercise primarily. And again, I think it's exciting too, because it's how can we use this to improve your lives, both your overall life and your cancer-specific survivorship as well. And even further, help us to better understand how we do this, how these effects can be done, so that we can get even more targeted at improving our lives. So with that, I'll open it up to anything, like you said. So, yes?
Yeah, I'm the kind of person that will dissect everything about my organs. So I have a question here when it comes to exercise. I hear this a lot. I would like to rationalize the significance of exercise. Is it because we circulate our blood more, which circulates chemo or any other kind of inhibitor or prescription from the big doc, along with your T cells and the immune system? Am I on target with this kind of?
You are, and we just don't. That's why we're doing this. We don't, from a scientific standpoint, understanding what is it. is it just turning on those natural endorphins?
Or that too.
Is there some benefit of that? Is it reducing this chronic inflammation? Because chronic, we want our T cells to clear abnormal cells, but there's a chronic inflammation that can be bad if you go too far. So
Right, and it'll give a chance for T cell per se, maybe a few B cells and a few other augmentees to reach the target area